طبعا شكرا دكتوره عزه على الدعوه الكريمه ودايما حضرتك بتعملي لنا سبورت وشكرا لحضراتكم. النهارده هنتكلم على immediate effect of diaphragmatic breathing exercise on shoulder pain and range of motion in patient with adhesive capsulitis. اشمعنى الدايفراجماتيك بريدنج اكسرسايز؟ برغم ان تخصصي علوم اساسيه، لكن الدايفراجماتيك بريدنج اكسرسايز دلوقتي involved in most of physical therapy techniques، اذا كان manual techniques او therapeutic techniques. The purpose of this study was to determine whether diaphragmatic breathing exercise have an effect on immediate impact كمان on pain and joint mobility in individuals with adhesive capsulitis. Adhesive capsulitis is a degenerative condition. Its prevalence is from 6% to 26% worldwide, leading to joint adhesion, synovial membrane hyperplasia, diminished joint cavity, and tightness of the capsule, which at the end result in hypomobility and restrict the activity of daily living. Once you're applying exercise involved with deep breathing exercise, it will help you to easing pain and severs tense muscle. But what is the relation between shoulder joint and diaphragmatic? The autonomic nervous system and respiratory system are closely together. Once you, the parasympathetic system is related to the phrenic nerve, which innervate the movement of the diaphragm. Exercise involved with diaphragmatic breathing stimulate the parasympathetic nervous system and the aminobutyric acid pathways, which at the end result in decrease the sympathetic nervous system activation and lessening the anxiety, pain, and also improving the overall function of brain and the cardiovascular system. Also, there is anatomical link, neurological link, and also myofascial connection between diaphragm and the shoulder joint. The diaphragm is extended from the trigeminal system to pelvic floor, passing from the thoracic diaphragm to the floor of the mouth. The phrenic nerve innervate the diaphragm, which is runs from the root of C35. The phrenic nerve are housed in lamina 9 in the ventral horn of cervical spinal cord. The pathway of the phrenic nerve involved the entire brachial plexus and also the entire cervical plexus C1, T1. Some examples for that the roots that may affect the phrenic disorder are C4-5, which mean dorsal nerve of the scapula. Also C5-6, which is specifically the axillary nerve, subclavian nerve, the musculocutaneous nerve, and also the suprascapular nerve. Adhesive capsulitis significantly affect persons between 40 to 60 years old. 24 patients participated in this study with officially diagnosed with shoulder adhesive capsulitis, aged from 40 to 60 years old. Divided into two groups. The first group is a control group, which just rest on the chair. But the second group is a study group, which received diaphragmatic breathing exercise for 20 minutes. Each set was 3 to 5 minutes, with resting 2 to 3 minutes in between. The adhesive capsulitis reduce shoulder ability to flex, abduct, rotate internally and externally, and also, additionally, patients with adhesive capsulitis report persistent night pain. So we measure before and after the treatment of the breathing exercise using the universal geniometer to treat the shoulder flexion, abduction, rotation, and also the severity of pain measured through visual analog scale. The results shown that in shoulder pain, PER-DT test reveal marked reduction of pain post-treatment in the study group only. And for shoulder range of motion, PER-DT test reveal marked increase in shoulder range of motion post-treatment in a favor of study group. Concluded at the end that diaphragmatic breathing technique for 20 minutes helped frozen shoulder patients with their shoulder pain and limitation of joint mobility to improve their joint mobility and reducing pain. So Therefore, it's necessary to add intervention to the standard protocol in treatment in patients of adhesive capsulitis. Thank you.
Thank you.